Unveiling the Hidden Threat, the Emergence of BTMPS, an industrial plastic chemical in illicit fentanyl supplies. Introduction. The illicit drug landscape is continually evolving, presenting new challenges for public health and safety. A recent and alarming development is the detection of BTMPS 2,2,6-tetramethyl-4-piperidal sebacate, BTMPS, an industrial chemical commonly used as a light stabilizer in plastics within fentanyl supplies across the United States. This unexpected adulteration raises significant concerns due to the potential health risks associated with BTMPS exposure. Understanding the implications of this contamination is crucial for individuals, healthcare providers, and policymakers to effectively address and mitigate its impact. As the opioid crisis continues to take lives, the emergence of a non-pharmaceutical synthetic contaminant in already lethal substances adds another complex layer to an ongoing public health emergency. Understanding BTMPS and its industrial applications. BTMPS belongs to a class of compounds known as hindered amine light stabilizers, HALS. These chemicals are primarily utilized in the plastics industry to enhance product durability by protecting against degradation caused by ultraviolet UV radiation. HALS compounds are especially prized in the manufacturing of outdoor and automotive plastics, where sun exposure can rapidly degrade materials. BTMPS, in particular, is used in sealants, adhesives, polyolefins, and coatings for electronics and packaging films. While these properties make BTMPS invaluable in industry, they render it wholly inappropriate and potentially dangerous for biological exposure. The compound is not approved for human consumption and lacks any safety data for ingestion, inhalation, or injection. This makes its presence in drugs meant for human use, whether knowingly or inadvertently added, a troubling red flag. Because HALS compounds are engineered for environmental persistence and resistance to degradation, they may also persist in biological systems, accumulating over time and interacting unpredictably with human tissues. Discovery of BTMPS in illicit fentanyl. In a groundbreaking study published in JAMA, researchers from UCLA and collaborators in community-based drug-checking programs examined fentanyl samples from 9 U.S. cities, including major hubs like Los Angeles, Philadelphia, and Baltimore. Of the 231 fentanyl-positive samples tested using direct analysis in real-time mass spectrometry, DARTMS, over one-third contained BTMPS, with concentrations that in some cases exceeded the mass of fentanyl itself. This high prevalence and concentration suggests that BTMPS is not a trace contaminant introduced accidentally, but may be added intentionally somewhere along the supply chain, possibly to bulk up product weight, mimic pharmaceutical additives, or even modify the drug's texture or appearance. Notably, the contamination was consistent across geographically diverse locations, pointing to its introduction high in the distribution network. Alarmingly, the study noted that neither producers nor consumers likely understand the full implications of using fentanyl laced with an industrial stabilizer. This points to a profound gap in harm reduction and drug policy as users face increasing exposure to novel adulterants that evade standard testing and may have no history of human safety assessment. Potential health risks associated with BTMPS exposure. At present, no clinical trials or human toxicology reports exist for BTMPS. However, several animal studies and chemical analog assessments suggest serious cause for concern. A study in Toxicological Sciences examining Tinuvin 770, a closely related HALS compound, demonstrated cardiotoxicity, ocular damage, oxidative stress, and sudden death in rats exposed chronically. These findings suggest a high likelihood that BTMPS, as a structural analog, may produce similar outcomes. Even more alarming is BTMPS's potential interaction with human neurological systems. It has been shown to block nicotinic acetylcholine receptors, critical for muscle contraction, attention, and autonomic nervous system function. Interference with these receptors may result in muscle weakness or paralysis, cognitive impairment or confusion, autonomic dysfunction, e.g., erratic heart rate, temperature dysregulation. BTMPS's lipophilic nature also means it can easily pass through biological membranes, including the blood-brain barrier, potentially leading to central nervous system (CNS) complications. In real-world reports, individuals who unknowingly used BTMPS-contaminated fentanyl described symptoms such as severe blurred vision and ocular burning, tinnitus, ringing in the ears, nausea and vomiting, burning sensation upon injection, persistent chemical odor, often likened to melted plastic or bug spray. These effects are not consistent with pure fentanyl intoxication and indicate a separate toxic profile that healthcare workers may miss unless aware of emerging adulterants like BTMPS. Moreover, the long-term impact of such exposure remains unknown. If BTMPS bioaccumulates or acts as a persistent endocrine or mitochondrial disruptor, its effects could emerge only after repeated low-dose exposures, raising additional concerns for users with opioid use disorder. Challenges in detection and implications for public health. One of the most dangerous aspects of BTMPS contamination is its invisibility in standard toxicology panels. Traditional drug testing, including autopsy reports and emergency room screens, do not detect industrial additives like HALS compounds unless specialized instruments and protocols are used. Community drug checking initiatives, especially those utilizing DARTMS and gas chromatography mass spectrometry, GCMS, have become instrumental in identifying BTMPS. However, these technologies are costly, require skilled technicians, and are rarely implemented outside of research settings or pilot harm reduction programs. The result is a silent epidemic, where users and healthcare professionals alike are unaware of the true chemical composition of substances being consumed. This complicates diagnosis, treatment, forensic investigation, and policy response. From a policy perspective, BTMPS's emergence represents a novel class of synthetic adulterants that challenge existing drug enforcement frameworks. Unlike controlled substances, BTMPS is legal for industrial use and not classified under any schedule. This allows it to be imported, purchased, and used without restriction, making enforcement and regulation nearly impossible under current laws. Recommendations for individuals and healthcare providers. For individuals, engage with drug checking services, seek out community-based or mail-in programs offering fentanyl strip testing or advanced spectrometry services. While these may not catch BTMPS unless specifically tested for, they can help detect other high-risk substances and promote safer practices. Tune in to adverse symptoms. If unusual symptoms arise, especially burning on injection, visual disturbances, or odd smells, do not reuse the substance. These may indicate contamination with industrial chemicals. Don't use alone. Always ensure someone is nearby who can call for help and administer naloxone. Remember, naloxone will not reverse effects from non-opioid contaminants like BTMPS, but it can save lives when opioid toxicity is involved. Document and report. If adverse effects occur, take note of them. Reporting to drug checking services, poison control centers, or harm reduction groups can help track the spread of contaminants like BTMPS. For healthcare providers, expand screening suspicion in patients presenting with atypical opioid overdose symptoms, e.g., ocular symptoms, nausea without sedation. Consider the possibility of HALS or plasticizer contamination. Utilize toxicology support services, contact poison control or specialized toxicology labs when traditional screens are inconclusive. Advanced techniques like high-resolution MS may be necessary. Support harm reduction. Educate patients and communities on emerging threats like BTMPS and advocate for increased access to drug checking and public alerts. Conclusion. The appearance of BTMPS in the illicit fentanyl supply is a sobering reminder of the ever-changing nature of street drug formulations and the lengths to which clandestine producers may go in pursuit of profit. With no approved human uses, no safety thresholds, and no toxicology surveillance in clinical settings, BTMPS represents a silent but growing threat to individuals navigating the opioid crisis. It is imperative that we expand harm reduction infrastructure, increase toxicological testing capabilities, and raise public awareness about the presence of industrial chemicals in street drugs. As this chemical emerges as a potential marker of broader adulteration trends, a swift and science-informed response may help us prevent an already devastating crisis from becoming more deadly.